Okay, we're going to begin the cardiac examination. And at first, I'm just going to be inspecting for the JVP, and I can already see it right here. And I'm also going to be inspecting for the point of maximal impulse. So this would be located at the 5th intercostal space, the midclavicular line, and I'm just looking for that pulsation. And I've noticed it right there. And so now I'm going to go ahead and measure the JVP. So I'm going to take my straight edge and then I'm going to find the sternal notch, and I'm going to just measure, and it measures a little over 1.5 centimeters, and that should be under 3 centimeters. And with the JVP measurement, you're just wanting to elevate the head of the bed about 30 degrees and measure it. And the patient is elevated about 30 degrees. And so now that we have identified that, I'm going to assess for the carotid arteries. Doing each side, noting those. And now I am going to palpate for the point of maximal impulse. And I'm just going to count because it's the 5th intercostal space. So we go 1, 2, 3, 4, and 5, and just my hand right here, and I'm going to be feeling for the point of maximal impulse. And I'm noticing for any thrills and heaves, and I feel the pulsation. And now we are going to do some auscultation. I'm going to listen with the bell, and I'm going to listen for any bruits. I don't notice any bruits, and now I'm going to auscultate for the S1 and the S2. So I'm auscultating now for the S1 and S2, and here I'm at the aortic. And I'm listening for the blood duct. And then I'm going to move over to the pulmonic. And then the Erb's point. Listen for the tricuspid, and then the point of maximal impulse, which is the apex. And I've noted S1 and S2. Now I'm going to assess for any S3 or S4, and I'm also going to use the bell of my stethoscope, and I'm also going to listen at the same area, the point of maximal impulse, and I'm just going to ask the patient if he can roll to his left side. That's good. and I didn't note any S3 or S4. And so now I am going to start a portion of the peripheral vascular examination. And I'm starting by inspecting the patient's arms. And I'm inspecting them for symmetry and for color. And I'm looking for any swelling. And also going to check his fingernail beds for capillary refill. Making sure that they are less than 3 seconds. And also I'm going to start checking the pulses. And so I'm going to start with the brachial and then the radial. I'm going to do this for both sides. And while I'm here, I'm going to perform the Allen test. And I'm just going to have the patient kind of dangle his hand, and we are going to do the Allen test. And I'm just going to ask the patient to open and close his hands. And then I'm going to place my thumbs over the ulnar and the radial aspect of his hand, and I'm going to ask him to close it, make a tight fist, and then I'm going to have him open his hand, and I released the radial artery, and I'm just looking for the blood to fill back up in the palmar area and in the fingers. And I'm going to ask him to do the same thing again. If he can open and close his hands, and I'm going to do that for the opposite artery. Okay, close your hand. Now I'm going to release the ulnar aspect. If you can open your hand. And we're just seeing if it does that at the same time. If the blood fills back up in the hands and the fingers at the same time. Okay, and now we are going to check the femoral arteries. And then we are going to do the popliteal artery under here. Artery. I'm not listening. I'm looking for the pulsation. And then I'm going to move on to the dorsalis pediis. On both. And then I'm going to feel for the posterior tibial. And so here I'm just looking for any bounding. I am looking for the +2, making sure there's no absent pulses. And now I'm going to do the Holman sign. A won't do that yet. First, let's, as I was feeling the patient, I was feeling for warmth and making sure the patient's legs were not cold. I'm also going to do capillary refill in the nails, and his toes. Looking for the, making sure that it refills within 3 seconds. And now I'm going to do the Allen test. So we're just going to have the patient, if you can lift up your leg and flex your foot this way. And then here I'm just checking and making sure there is not any tenderness. Okay, you can put that back down. And so this will complete the cardiac and the peripheral vascular portion of the exam.